Dear friends, I am Dr. Abdul Ansari. I am the Director Critical Care Services for Nanavati Super Speciality Hospital. It's a privilege and a proud moment on this Doctor's Day to introduce myself as the Chief and Director of our state-of-the-art intensive care facility, which has we can boast of one of the best centers for neurosciences, transplant and surgical intensive care, complicated medical care, as well as capability of handling highly infectious respiratory diseases in the newly inaugurated isolation rooms. We very soon want to take over the challenge of treating the most difficult intensive care population of acute respiratory distress syndrome because of our tropical illnesses, the cardiac failure, because we want to undertake the cardiac transplant, liver transplant, and we are already having a successful ongoing bone marrow transplant center. This Doctor's Day, I would like to dedicate our intensive care to the untiring work of our critical care team, our critical care outreach team, for the rapid response team throughout the hospital. And we are very outcome centric. We want to ensure that our results and outcomes are best in this part of the world and probably comparable to any other place worldwide. We want to reassure all our patrons that the healthcare facility would be available 24/7, and whenever you are into a critical scenario, please think of us. We will not be found lacking. Very importantly, I want to pass a message this Doctor's Day that let's all respect each other professionally and let's refrain from medical jousting. This is something which is plaguing our community as we see in the spate of increasing violence against our fellow colleagues. Probably we should not add fuel to the fire by partaking in medical jousting. We must ensure the respect and the professional integrity and the contribution and the limitations of our fellow colleague, and we should defend them as long as possible in as much of a diplomatic way, because we really cannot understand in which situation the patient had previously been. With this, I would like to thank you all and pass the message that our critical care program at Nanavati Super Speciality Hospital is ready to take on these new challenges, and we will try to push it to the highest of the limits. Dear friends, it gives me immense pleasure this Doctor's Day to tell that our critical care team has a special focus on nephrocritical care, and very soon on 23rd of July, we are going to have an acute kidney injury CRRT, that is continuous renal replacement therapy workshop, which would be in the premises of Nanavati Super Speciality Hospital. This is just a flyer, and we will very soon have a detailed program distributed amongst our colleagues and patrons. And it will be a pleasure to see you all for this AKI CRRT 2017 workshop at Nanavati Hospital. To end, I would just like to say our motto is right care at the right moment. With this, thank you all. Jai Hind. Have a great Doctor's Day.